Welcome to this presentation, Implementing Curricular Change for Interprofessional Healthcare. My name is Charlotte Bates. Interprofessional education. What is it? Why do we need it? And what are we going to learn today? What is IPE? And we'll use IPE instead of interprofessional education. It occurs when students from two or more healthcare professional programs come together to learn about each other's profession, learn effective communication skills, and work collaboratively together to improve patient outcomes. Why do we need IPE? IPE within the healthcare professional programs is needed because it will prepare graduates for the working environment where team communication and collaboration skills are necessary. There is a push from local and regional healthcare organizations for our students to have these interprofessional competencies, skills, and values. So what are we going to learn today? Here are the objectives for this presentation. Describe the World Health Organization's call of action for interprofessional healthcare education. Discuss the need for interprofessional healthcare education. And analyze the Cotter's 8-step change model as a possible plan to implement curricular change in the healthcare programs. In 2010, the World Healthcare Organization issued a call to action to add interprofessional education, IPE, and collaborative practice to healthcare programs. This call was to help alleviate the lack of students entering healthcare programs and the workforce shortage that was happening globally. As you know, a shortage of healthcare providers is critical. When there is interprofessional collaboration between healthcare providers, it lessens the burden. Therefore, it is necessary to incorporate interprofessional courses into our healthcare programs. Also, there is a need to change from the traditional methods of teaching and the silo effect of compartmentalizing each healthcare program. Levitt and Jones noted that interprofessional collaboration has a significant effect on patient outcomes, and it also adds knowledge and skills for making the appropriate healthcare decisions. So I did a literature review because I needed to find information on how to begin the process and a framework for developing and implementing the IPE. So first I looked at successful IPE initiatives, and then I looked at models for or frameworks for beginning the process. So first we're going to look at several case studies that were successful in implementing their IPE initiatives. The first one we'll look at is an interprofessional conference. Gilding noted that an IPE conference on appropriate antimicrobial management was developed and well attended by students from undergraduate medical and pharmacy students. Lectures were delivered by specialists, and small interprofessional group lessons and simulations were completed. An evaluation survey was given to each participant, and the results were positive for the conference. Therefore, the Educational Institute determined that there would be 4 interprofessional healthcare conferences each year for their students to attend and participate in. So this is one way to implement interprofessional education into healthcare. I found a great systematic review by Levitt Jones. He reviewed 7 IPE case studies to gain knowledge about innovative techniques and methods for including IPE activities in curriculum. It was noted that nursing, medical, and allied health graduates were lacking communication and collaborative skills needed in healthcare settings, and that it was important to discover successful methods or approaches to include these skills and teams within our healthcare education. So the first one that we will look at is the use of e-learning modules. So Australia used an e-learning module to incorporate IPE into their healthcare programs. The e-learning modules could be used with 2 or more healthcare programs or with individual programs to highlight other healthcare providers' roles. The modules focused on medication safety, quality of medicines, and adverse patient outcomes. Finding from this quasi-experimental study reviewed that IPE modules were effective. The number of students in the experimental group indicated a higher intention to practice medicine safely and collaboratively. Oregon Health and Science University IPE initiative included students and clients and nursing faculty and residents. The Interprofessional Care Access Network, ICANN, involved the nursing faculty and residents who facilitated community education programs in low-income and underserved neighborhoods. Students from nursing and other healthcare communities were assigned into IPE groups and then were given 2 to 4 clients in these neighborhoods to work with and educate on healthcare issues over a period of time. It proved successful and continues today. In another type of IPE, Lund University in Sweden implemented a mandatory ward-based interprofessional educational experience. The interprofessional teams were made up of nursing, medical, and physiotherapy students. It took place in a small 14-bed ward that specialized in geriatric care. Each team provided routine care for 3 to 6 patients for a period of 8 days. Supervisors were on hand at all times. Data on these experiences were collected through written reflections from each student. This IPE has been running for approximately 6 years, and feedback has been positive for teamwork, communication, and supervision. First-year healthcare students at Keele University in London participated in a 2-day IPE activity to enhance their knowledge of each other's healthcare programs and responsibilities. Groups of 15 students from multiple programs met to discuss compassionate care, ethical practice, teamwork, and professional roles. Assessment included a poster presentation. Feedback from the students and staff were positive, with students noting they had a better understanding of the concepts covered in the IPE activities. Okay, now let's talk about the POEM project, the IPE for ontology, epistemology, and research methods students, POEM. It's a critical thinking IPE developed by Central Queensland University in Australia. It aimed to enhance communication, collegiality, and interprofessional perceptions between research students. This IPE included ontology, epistemology, and methods activity research students. The innovative method had paired students in the same field to reflect on their research approach, philosophy, and then to develop a poem representing their views. These poems were presented to the entire cohort with discussion on professional similarities. Positive results were noted by participating students, with comments that the IPE activity increased their understanding of the different research areas. Very unusual. In a university at Singapore, they created a safety workshop. This IPE focused on the 2011 Joint Commission's 6 patient safety goals, with 6 learning sessions that covered correct patient identification, effective communication, medication safety, correct patient site, correct procedure, reduced acquired hospital infections, and fall reduction. Interprofessional teams consisted of medical, nursing, and pharmacy students. Several teaching methodologies were used to include lecture, videos, root cause analysis of case studies, and role-playing. There was a 95% response rate to student evaluations about the 6 sessions, with about 86% of students responding positively to this one-day IPE activity. In the United States, the Institute for Professionalism and Ethical Practice added a new component to its program to enhance relational and communication skills workshops. The inclusion of monthly educational forums or rounds within a pediatric clinical unit was used. The monthly rounds have continued since 2010 with the goals to enhance relational and communication skills of nursing and other healthcare professionals within this pediatric hospital. The rounds are 1-hour educational activities that offer healthcare professionals, parents, and patients time to interact as they discuss challenging topics such as caring for a dying child. Patients and families are involved in these rounds to allow all participants to develop communication skills and break down preconceived stereotypes. Interprofessional teams and participants come together and discuss difficult conversations and scenarios. Role-playing by actors helps to simulate some of the scenarios and helps participants understand the importance of good communication between team members. This type of situational workshop breaks down barriers between healthcare professionals, patients, and parents as they are face-to-face and one-on-one to discuss these scenarios and what is best for the patient. Next, let's talk about the development of a new degree. So the Heidelberg University in Germany created a Bachelor of Science degree in Interprofessional Healthcare, IHC. This degree was to meet the demands of healthcare organizations. The degree allows for allied health students to complete their 3-year vocational track and simultaneously complete the IHC degree. It addresses the need to have interprofessional communication skills, interprofessional healthcare skills. It has a section of English for non-English-speaking students, a section on medical error communication, and on small business management. This change, as I said before, came about because of local and regional and state level needs. And we'll talk about the planned methodology used to develop this degree. Okay, so how do we begin the process of developing an IPE and implementing it into our curricula? So each of the IPEs that we've looked at were successful because they were planned out and developed. So they need to be planned, developed and implemented, but they also need to have continuous evaluation with measurable outcomes so that we can continually improve each of the IPEs. So we were going to look at the Cotter's 8-step method for plan change. The plan change I want to share with you today is the Cotter's 8-step change model. As can be seen from this diagram, the 8-step change model is stepwise in design and each step builds on the other. We'll next take a closer look at each one of these steps. So step 1 is to create a sense of urgency. We want to get the conversation going by explaining the need for IPE and its importance to improving healthcare environment and for improving patient outcomes. According to Cotter, 75% of the organizations must be on board for a change to pick up momentum and be successful. So we need to look at the opportunities that are available. What have we used in the past? Look at case studies as we've done today and see what we can use to get a sense of urgency and get that information out there. In step 2, we need to form a powerful coalition of stakeholders. So we will need to identify strong leaders in each of the healthcare programs, identify community leaders and stakeholders that will support the IPE change, which would include hospital, clinical sites, and community leaders. We need to bring this team together for team building skills, communication skills, and management skills. So we will need to make sure that we have a mix of interprofessionals from all of the healthcare programs, management, and education. The third step is to create a vision for change. We need to determine the values of the change initiative. What value does this IPE bring to the programs and the community? We'll need to create a short vision or mission statement and then create a strategy to implement the change. And while we're doing this, we need to make sure that the coalition members are versed in the mission and strategy for accomplishing the IPE initiative, so that anytime anyone talks to them, they'll be able to give them an answer. So the fourth step, of course, would be communicating the vision. As I said in the previous slide, coalition members need to be versed on the mission and the vision and the strategy for accomplishing this initiative. The vision needs to be communicated frequently. It needs to be used daily in conversation, in decision-making, and problem-solving. We need to address concerns and conceivable problems others may have about the vision. So in other words, use all types of communication to get the vision out in front of everyone involved, the healthcare programs, the community, the healthcare organizations. Okay, so we've got the vision out there, we've communicated it clearly. Now we need to look for and remove obstacles or barriers we may run across. One way to do this would be to review your organization's structure, job descriptions, performance, and compensation. These may have to change in order for the implementation of the IEP to be successful. We need to look at, recognize, and reward individuals who are working towards the vision and towards the IPE change. We can reward them verbally, recognize them at meetings. We also need to look at individuals who are resisting IPE and the change. We may need to sit down and discuss in more depth the need for the change and see why they are resisting the change. If we find a barrier, we need to take action to remove the barrier. And this just may be discussing it with an individual who is resistant. As we continue building on our plan and implementation, Step 6 discusses short-term wins. Short-term wins, we need to break our IPE process and implementation into small, achievable projects. And we need to review and analyze each project to make sure it will be successful. And these projects need to be limited in time to achieve and in expense. These types of short-term wins can be celebrated and keep the momentum moving forward as we begin the process of change. So we're going to continue to build on change as we look back at our short-term wins so that we can make sure that each continuous project is improved. We can use the brainstorming method to improve our projects, and as we have wins, this will help keep our momentum going. Step 8, which is the last step in the Cotter's 8-step process, is anchor your change. We need to anchor the change in our core curriculum and in our college organization. We need to publicly recognize key stakeholders, especially as they rotate off or on to the IPE coalition. We need to introduce the IPE to new hires and reiterate the process, the vision, and the accomplishments in training sessions and review it with the community, and the college programs. So now we're going to take 5 minutes to do a brainstorming activity that actually pairs up nicely with step 2 of the Cotter method. Each of the tables have 3 sticky notes pads, and what we're going to do is we're going to brainstorm at your table and try to determine one individual who will be a leader in your program, one individual who is a leader at your clinical site, and one individual administrative leader from your college, your department, or from one of your clinical sites that you think will be a good stakeholder in the implementation of this IPE. If you think of more than one, that's okay. So here's the color code. The yellow sticky pad will be used for program leader, the blue sticky pad for clinical site coordinator, the pink sticky pad will be for administrative leaders. You can have more than one for each of the categories, and when you get through, you can stick them on the whiteboard up here under the color code key. So I'll tell you when time's up, so go ahead and get started. Okay, time's up, and we have all of our sticky notes up on the color key whiteboard. You did a great job. We've got a lot of names that we can begin contacting and discussing the implementation of our new IPE into the healthcare program's curricula. So let's just do a quick conclusion and questions. All right, so today I have discussed with you the call to action by the WHO to implement IPE into our healthcare curricula. We have seen several IPE initiatives that were successful and how they were implemented. I have also shown you one change plan method, the Cotter's 8-step plan. which is a viable choice to begin the process of changing the healthcare programs at this university and to reflect the WHO vision to have professional, interprofessional healthcare education and graduate professionals capable of meeting the demands of our community and our regional healthcare needs. So at this point, I'll be open for questions. And for those of you who are interested, I have included a list of references with embedded links. If you would like a copy of these references, I have them up front in a PDF. Thank you so much for coming to this presentation and beginning the process of interprofessional education into our healthcare program.